really we need to be investigative in the way that we are treating women and ruling out all of the possible sources of your discomfort.
Hi, welcome back to the channel. My name is Molly, and today at Live UTI Free, I'm chatting with Jenna Perkins. If you're new to our channel, be sure to check out the description below, as we've linked to other resources that you might find helpful. Lastly, if you enjoy these videos, think they're important, and want to support what we do, be sure to hit subscribe and tick the bell so you get notified when we post new videos. And other than that, we hope these videos provide the insights you need to take the next step in your UTI recovery journey. Joining me today is Jenna Perkins, a women's health nurse practitioner in urogynecology and sexual health. Welcome, and thank you for taking the time to share your insights with our community.
Yes, thank you so much for having me. I'm so excited about this.
So to get started, I'd love to hear a little bit about you. Could you tell me about your background and your work as a women's health nurse?
Yeah, so I am Jenna Perkins, a women's health and gender-related nurse practitioner. So I actually started my career in urogynecology, so helping to be the bridge between the women's health world and the bladder world. And I was at a academic center, downtown busy clinic in DC, and very quickly realized that there were a lot of young women with recurrent urinary tract infections who were just kind of spinning their wheels trying to get answers. So very proud to have been able to build a practice, and that led to now a business. I'm the owner of DiscovHER Health, where I help women start to get answers and kind of put the pieces of the puzzle together, because you are one fully functioning system and everything is so connected.
And in terms of UTI, how do you typically approach them with patients?
So UTIs are one of my favorite things to treat, honestly, because if it is just a regular UTI, then that's easy. Here are some antibiotics, and then let's talk about ways to prevent it and obviously to treat it. But if it's not a UTI, that's when we really get to put on our investigative hat and start to figure out, okay, it might feel like a urinary tract infection, but we're sending out the labs and it's coming back and everything is clear and normal. So what else could this be? And so I'm able to treat conditions that might mimic the symptoms of a urinary tract infection and really spend the time that women need to investigate what's actually happening. Is it the muscles? Is it the bladder itself? Is it the tissue that should be supportive and preventing these urinary tract infections? Like, really, let's dig deep and figure out what's actually going on here so that we're not, again, spinning our wheels.
Mm. And when a patient presents with UTI symptoms, how do you decide which tests to use?
Yeah, so definitely we start with the screening test. So we want to do an office dip to see, do you have the signals that are going to tell us that you might actually have a urinary tract infection. So are there white blood cells present? Are there red blood cells present? And then after that, what we do is we send it off to the lab through insurance to do what's called a culture. So that urine culture is really what's going to grow out bacteria, because sometimes you can have the screening test positive. So maybe you have blood in your urine, but then we send it out to the lab and no bacteria actually grows. So in cases like that, we might be giving you antibiotics over and over again for no reason, because there was never any bacteria that was actually present. Maybe the blood was coming from a kidney stone that we've missed. More likely, the blood is coming from the opening of the vagina where the urethra lives. It's called the vestibule. And so when you have hormones that are influencing this area, if you don't have enough hormones supporting this tissue can become raw, irritated, and you can have bleeding that's actually not coming from the bladder itself, but coming from the tissue around the bladder. So that can kind of throw off our test, where if we're only looking at those screenings and saying, okay, you have blood in your urine, this must be a UTI, then we're really doing a disservice to women, because you could definitely have other causes of that bleeding, like a kidney stone, like sensitive, raw, thin tissue. And we really have to treat those things in order to make progress.
We hear from many individuals in our community about the burden of negative test results despite clear symptoms. You've touched on this a little bit, but what do you do when symptoms and test results don't match?
Yeah, so I investigate what I call the big three. So first are muscles. So are your muscles tight and tender? So the pelvic floor muscles can be tight because if you did have an actual urinary tract infection, your muscles are like, hey sis, I am uncomfortable, so I'm really going to tighten up here to go into protection mode. So we really need to make sure that those muscles are nice and relaxed and not sore because the symptoms of a UTI, like urinary urgency, frequency, pain with urination, can very much mimic the pelvic floor muscle tension and pain. And so we definitely want to investigate the muscles to figure out if they are actually the culprit. So the second of the big three is going to be tissue. So I like to do a procedure called a vulvoscopy. Some women have heard of the word colposcopy, where we use a magnifying lens or a high-powered camera to look at the cervix for signs of cervical cancer. We can actually do that same procedure and look at the vulva, so the outside of the vagina, particularly looking at that vestibule where the urethra resides. And we can investigate, okay, does the tissue look red? Does it look thin? Is it inflamed? And is that the real culprit, right? So we investigate the muscles with a simple exam by pressing on the muscles essentially and saying, hey, is it sore? Does it hurt? Is it tender? Are your muscles able to contract and relax properly? And then we investigate the tissue by doing the high-powered investigation with the camera called a vulvoscopy to really see, are there other sort of tissue issues that could be contributing to your symptoms too? And then the final is nerves. So there are a subset of women who are born with more nerves than the average bear or more sensitive nerves than the average bear. So these would be our women who come in and they're like, I have these UTIs. And then we're doing all the screening, everything is coming back normal, right? We're doing the culture, everything is normal. You actually don't have a UTI. What's going on here? We do the vulvoscopy, it is normal, right? Your muscles might be tight, maybe not. Maybe you've done pelvic floor physical therapy. But then I ask more specific questions like, hey, tell me about your belly button. Is it very sensitive? Because that could be a sign, if you do have sensitivity at the belly button, it could be a sign that you're going to be hypersensitive at the vestibule too, so that opening area. When you're an embryo in mom's belly, the umbilical cord, or what turns into your belly button, and the vulvar vestibule are the same tissue. They are derived from the same area. And so there's a subset of women who will have hypersensitive nerves in the belly button and in the vestibule. And so we definitely want to rule out nerves as one of the big three to make sure that we're not missing something that is oftentimes called a UTI, but rarely truly an infection.
Okay, and what other conditions do you keep in mind when someone has symptoms of a UTI but negative culture?
So definitely the thinning of the tissue, we call that vulvovaginal atrophy. That can happen with birth control use. It can happen with breastfeeding. We see it quite often in perimenopause and definitely in postmenopause because estrogen really allows blood to flow to the tissue and allow the tissue to be healthy and plump and protective. So we definitely want to rule out the hormonal influences that lead to the vulvovaginal atrophy and treat that with a local hormone cream or gel that might have estrogen and even testosterone often. So we want to rule out hormones. We want to rule out vulvodynia. Dynia is the Latin word for pain. Pain in the vulva just means, hey, it hurts outside of the vagina. And there could be a number of reasons that you have the vulvodynia. It could be the hypersensitivity of the nerves. It could be the thinning of the tissue. It could be the tension of those muscles. But that's often a diagnosis that women will either come with already or that we give them. Vestibulodynia is another diagnosis that just means more specifically, hey, my labia don't hurt, maybe my clitoris isn't bothered, but that opening area, that vestibule specifically, is hypersensitive or painful. So vestibulodynia is another diagnosis that you may have already come with or that we might give you. We also want to rule out other common skin conditions, or not very common, but other skin conditions that could be present, things like lichen sclerosis. That is an autoimmune condition where the tissue just doesn't heal properly. And so you can have lots of like burning, irritation. It usually presents as yeast infections, but sometimes women will say, I feel like I have a UTI because of the burning symptoms that the improper healing of the vulvovaginal tissue can cause. Pelvic floor dysfunction is a diagnosis that means that those muscles in the pelvis are not properly functioning. So oftentimes you're feeling like you have a UTI because you are being tight. We, including myself, can have a lot of tension built up that can present and manifest as UTI-like symptoms. So those are a number of diagnoses. Kidney stone, the kidneys you could be sort of predisposed to having stones genetically, or your diet might contribute to you having more kidney stones. Whatever the case may be, if you have a tiny stone hanging around and we miss it, it can harbor bacteria, so you can have more actual UTIs. It also can cause some of those irritative voiding symptoms that we see with the UTI. So maybe your culture comes back negative or normal, but you have a kidney stone, so you still have the frequency, the urgency, the back pain because of the stone that is present. So we definitely want to rule out a kidney stone. I think those are some really good examples, but there are just so many reasons that you can have dysfunction in the pelvic region because there's so much function that happens in the pelvic region. And so really we need to be investigative in the way that we are treating women and ruling out all of the possible sources of your discomfort.
We hear from a lot of individuals in our community about the overlapping symptoms between UTIs and other conditions they've got as well. So, yeah. Could you tell me about the pelvic floor muscles and how they impact our bladder health?
Yeah. So the pelvic floor muscles are this group of muscles that are in charge of breathing, they're in charge of pooping, they're in charge of peeing, birthing, intimacy. So again, so much function is happening in the pelvic region. And the pelvic floor muscles are just the group of muscle that work together to impact all of that function. And so, say for instance, if you are chronically constipated, your pelvic floor muscles are trying to keep your bowels steady, right? Because you don't want to poop your pants. And so it can happen where the muscles are like hanging on for dear life, saying, hey, friend, now's not a time to go to the bathroom. So we're going to stay persistently tight. Your brain doesn't necessarily know the difference between my muscles are tight and irritated and my bladder is full. So constipation can directly influence the perception of urinary urgency, of urinary frequency. Those same muscles don't always know how to relax when it's appropriate. So when you finally make it to the bathroom and you try to have a bowel movement, if those muscles are hanging on tight and you don't know how to intentionally relax those muscles, you're going to have a hard time having bowel movements. It's also going to be difficult with tight muscles to completely empty your bladder. So you could have what we call a post-void residual, where you're hanging on to a little bit of urine every time you urinate. And so your brain is going to give you the message that your bladder is full more frequently, because it might be full more frequently because you're never actually completely emptying. You can imagine that bacteria is going to have more time to grow inside of a bladder where the urine is never completely emptied too. So you are going to possibly have more irritative voiding symptoms that are not actually a UTI, but also be more at risk of getting an actual infection if you're unable to completely empty your bladder. So these pelvic floor muscles need to be able to be relaxed for penetrative play. So if you want to have like penis and vagina intercourse, for instance, if those muscles are persistently tight and sore, that's going to make things very, very uncomfortable. These muscles need to be relaxed in order to have an orgasm, right? If your muscles are so tight, the contraction that typically happens with the orgasm, your muscles are like, hey, sis, I'm already hanging on for dear life. I'm not going to be able to contract more unless you can intentionally have them relax that baseline. And then you get those satisfying contractions that can occur with the orgasm too. So the pelvic floor muscles are really what I call the seat of life. right? There's just so much function that is there that there's a ton of room, unfortunately, for dysfunction.
And what treatments do you typically use when individuals are experiencing pelvic pain?
Yeah, so at my practice, DiscovHER Health, the HER is kind of the framework for our method of treating women. So we have healthcare, education, and resources. We use that framework and we have a journey that women take with me under that framework. And so the first stop on that journey is what I call the hormone reset. So we're definitely making sure, again, are you using local vaginal hormones to support that tissue? Do you need maybe systemic hormones to make sure that your systemic hormones are optimized so that you're feeling well overall to prevent UTIs? Second stop on that journey is going to be our pelvic reset. So, how can we get you to relax your muscles? So, we can refer you to pelvic floor physical therapy. There are medications like CBD suppositories or even diazepam suppositories that we can use to get you to medically relax those tight muscles. I use a very innovative technology in the practice for tight pelvic floor muscles. It's a form of red light therapy. It's called solar pelvic therapy, and I really enjoy this. This is a sort of intervention that if you've been to pelvic floor physical therapy and your muscles are still tight, or and you've done the medication and you're like, okay, am I at the end of my rope? This intervention can be super helpful for women to get those persistently tight muscles to actually be able to relax. And the idea behind it is that the red light will allow the vascular system in the pelvic floor to allow more blood flow to the region so that you have more relaxation that is able to occur and therefore less pain, less irritative voiding symptoms like the frequency, the urgency, the burning with urination. Um, Part of our pelvic reset also includes vaginal rejuvenation. So we can use a different form of energy to really allow the tissue to be better supported, to have more collagen there so that it's not so thin, so easily irritated, so that your bacteria is not readily entering into the urinary tract because you have some layer of protection essentially. So vaginal rejuvenation is a part of the treatment plan too. So hormone reset, pelvic reset, and then we look at metabolic reset. So what is happening? Are you diabetic, right? So if you don't have good glucose control, that can definitely cause these irritative voiding symptoms and make you feel like you have a UTI. So we definitely want to be treating you for weight management, for diabetes, so that you can have more bladder control because everything is so intimately and intricately connected. So basically, along that journey and under the framework, we are able to treat you as a whole person.
I think many patients report feeling dismissed when seeking care for recurrent UTIs. What do you think drives that type of response from clinicians, and how do you work to counter it?
Yeah, a number of things. The first is that a lot of clinicians aren't trained or taught how to actually treat urinary tract infections. We know how to treat with antibiotics, that's easy. We write the prescription, send you on your way. But if that does not work, what are the next steps, And if they don't have someone like a urogynecologist or a pelvic health specialist that they are referring to, it can be very frustrating. And so, as a clinician, if I've not been trained on the investigative work that is necessary to rule out the muscle disruption, to rule out the tissue issues, to rule out the nerve concerns, then I'm going to be frustrated and I don't have the proper tools to be able to fully treat you. The other thing is that the way that our healthcare system works here in the US, at least, we get 5 minutes with you for a problem visit. And how can you do all of this investigative work in 5 minutes? It's not possible. And so it can be very frustrating, and lots of patients will feel dismissed because you kind of are being dismissed, right? I like to bring up this imagery of me talking to patients and having my hand on the doorknob. Like, I want to talk to you about your intimacy and your low libido and your vaginal dryness, but I also have to go into the next room, just because of the way that reimbursement with insurance works. So the way that I've been able to combat this is be intentional about the way that I treat women. And with that is time. When I launched my practice, DiscovHER Health, I was very much against the quick visits because I know that the medicine is in the relationship and the relationship is allowed to blossom with time. I have to be able to get to know you. I have to be able to do my investigative work to understand your body better, to be able to give you the proper treatments. And so I spend an hour with every new patient, which is a lot of time, and we can talk about all of these things that maybe you didn't even know were connected to your bladder, right? Like when I have an hour with you, I can ask you about your belly button. If I only have 5 minutes with you, why would I ever prioritize that? I just can't do it. And so we can get a lot more information when we have the time to be able to get to know one another, to figure out what you've done in the past, what's worked, what hasn't worked, and what our next move should be. So that's how I've been able to combat it at DiscovHER Health, is by having these longer visits, especially with that hour-long initial consult. And then we have accountability with my patients. So most women I'm seeing monthly until you are in a good spot, so that, if we try an intervention, you're not waiting a year to come back at your annual exam and say, hey, I tried that vaginal estrogen cream and it didn't really help, right? We have the ability to see you. And even at those follow-up visits, we get extended time. So we do 30-minute visits even at that follow-up. So we have time is the medicine.
Thank you. Before we finish, is there anything you'd like to share with individuals in our community who are navigating recurrent UTIs, pelvic pain, or long-term symptoms? Anything you wish more patients knew or felt empowered to ask?
Yeah, I would say give yourself grace. The fact that you're watching this right now means that you are committed to your health, that you are in transition, that you are growing from this experience, and understand that there are shortfalls that you don't necessarily control, right? The way that our healthcare system is set up, you don't have any control over that. And so just be very patient with yourself, be very kind to yourself, and understand that maybe you've met with one provider, two provider, three providers, right? And you're just looking for the right fit. And so it's very important to just keep working at it. Try not to be frustrated with your providers. They truly are doing the best they can with the skills and the tools that they have. And so just continue to work towards finding that right fit, finding somebody that you trust that can help you on this journey, because it will be a journey.
What is the best way for patients to reach out to your practice to learn more or book an appointment?
Yeah, so you can book online at discovherhealth.com. That's DISCOVHER health.com. You can find us at DiscovHER Health on major social media platforms, Instagram, Facebook, TikTok. And you can always email us. Our email is info@discovherhealth.com. I am licensed in DC, Maryland, Virginia, Florida, Arizona, Delaware, and Massachusetts is the one that I'm missing. So happy to see you if you need that support.
Thank you. And thank you for taking the time today to join this interview. I will link your details in the description below for anyone who's interested.
Thank you so much for having me today.
Thank you. Thanks so much for watching. I hope you found this video helpful. You're always welcome to reach out to us for more information about clinicians who specialise in recurrent and chronic UTI. Our contact is in the description. If you'd like to learn more about this or related topics, be sure to check out our other videos, or head over to liveutifree.com for other articles on recurrent UTI treatment options. Of course, if you like what we're doing on this channel, make sure to hit the subscribe button here on YouTube and tick the bell so you get notifications about future videos. Thanks so much for joining us for our Clinician Insight series. If you have suggestions for who we should interview next, be sure to drop us a comment.